Okay, so I'm gonna ask Sophie to open her video. She will start by explaining a little bit about the program.
So my name is Sophie. I'm a third-year dental student at McGill. And back in 2017, I was a Dent P. So a bit later, I'll give you a bit of insight on that. So I'm just going to start off with a brief overview of the programs, and my colleagues will go into further details in the following slides. So there's the four-year DMD program, which is the one pictured, the upper arrow. And it is 4 years, and it is meant for people who have a bachelor's degree or higher education. And then there's the 5-year program, which is the Dent P program. So it's exactly the same as the 4-year program. However, it has a preparatory year preceding the 4 years, which is called the Dent P year. So the Dent P year is under the Faculty of Sciences and not under the Faculty of Dentistry. And following that, you enter the Faculty of Dentistry along with everyone else who's doing the 4-year program. The first year of the 4-year program is mostly with your medical colleagues completing a curriculum called Fundamentals of Medicine and Dentistry. In the following year, you finish off FMD and move into Foundations of Dentistry, as well as the preclinical simulation, which Christina will touch on later. And then finally, in third and fourth year, you're mostly in clinic, and you'll also have didactic courses to follow. So the Dent P year, as I said before, is under the Faculty of Sciences, and it is the perfect year to adapt to university life. So it's meant for people who have come out of CJEP and want to go into dentistry. You just need to do this year first. So since it's under the Faculty of Science, you consolidate basic scientific knowledge, and you also have a chance to develop and enhance intellectual and cultural interests. So you typically take 10 classes throughout this year, and 4 of those are electives, and it's going to be the only time in the 5-year program that you have a chance to take electives. So it allows you to pursue other interests or hobbies that you may have, so you can learn a new language, you can take a music class, you can take an economics class. So it's really a chance to explore and have the typical undergrad experience, but it's just 1 year instead of doing an actual undergrad. And back to touching on adapting to university life, it allows you to learn how you like to study, learn how you like to listen to your lectures. In the past, we could go to a lecture in person or we could do it online. So it's a perfect time to decide how you like to learn and how you like to study. So you also learn how to make choices, you practice and develop teamwork, and you seek personal growth. So that one's really important because when you're a Dent P, you're entering the DMD program at 18 or 19 years old, which is significantly younger than most of your colleagues who have finished undergrad and are usually 22, 23, 24 years old, and a lot of them are older than that as well. So it's a perfect year to mature a little bit and learn about yourself and grow before starting this intense 4-year journey. Finally, to complete the Dent P year successfully, you must meet a minimum GPA of 3.5 out of 4 with no science cores lower than B to continue into the DMD program, which can sound daunting, but it's something that everyone does together and it's very doable. So just to touch on the experience of being a Dent P, it is an amazing year and an amazing experience. So typically, like Mary Claude said before, there's 10 Dent Ps. And so you really make friends that year. You become close. Even if we didn't see each other in all of our classes, we always made efforts to have dinner together or to have a study date. So all 10 of us got close during that first year, and we continue to be friends now as well. You also get a chance to meet the Med Ps, who are usually a larger cohort, but you get a chance to hang out with them, and there's a student association for the Med Ps and the Dent Ps, so you really get to bond and go on ski trips and do activities together. And finally, you also have a chance to make friends who are going to be an undergrad, who are not going on this 4-year journey into dentistry or medicine, and you can continue seeing your friends who are in undergrad and take classes with them. So all around, it's a very well-rounded social experience as well as educational experience. So So for anyone in CEGEP who is thinking about going into dentistry, I would highly recommend the DentP program at McGill. Thank you, and I'll pass it off to Bushra now.
Thank you, Sophie. So my name is Bushra. I'm a second-year dental student, and I'm going to talk about the first part of the curriculum, which Sophie mentioned is the Fundamentals of Medicine and Dentistry, or FMD. You'll be completing FMD during the first year and the beginning of the second year in the program. So the FMD curriculum is divided into blocks, each focusing on a different area of medicine. So within each block, they've integrated a variety of basic science courses, as well as labs and small group activities where you work in smaller groups, usually doing something case-based. For example, in Block J, which is human behavior, you'll learn about head and neck anatomy, physiology of the neurological system, pathology, histology, clinical psychiatry, and much more. Next slide, please. So in FMD, there are also a number of longitudinal themes which will be touched upon throughout the entire curriculum. These themes can include public health, Indigenous health, and community health services. In addition to the FMD curriculum, there are also dentistry courses which you will be taking that include community oral health services, oral health research, and dentistry apprenticeship. You'll be learning the introductions to oral medicine, dental anatomy, and you'll be performing dental wax-ups. So my perspective, having almost completed the FMD curriculum, is that it's been a really good experience. I've had the time to slowly adjust to the demands and be prepared for the intensity of the dentistry curriculum. I've also gotten to enjoy university and bonding with my classmates. It's nice that we have a really small class and that we're able to make lasting friendships. And for me, one large reason why I decided to do dentistry at McGill was because of the excellent reputation for teaching, research, and service to the community, and all within the context of Montreal. And I'm able to make use of all three of those really early on as a second-year dental student. And this is really evident once you enter the faculty. So next, Christine will explain preclinic.
Hi, everyone. I'm a fourth-year dental student. My name is Christina, and I'll be talking about what happens in the second half of second year, then leading on to third year, and then finally fourth year, the year I'm in. So the second half of second year, as Bushra had said, after the FMD program, we enter preclinical studies. And this is for a duration of about 6 months. It starts in the winter semester. And this essentially is where we delve into dentistry in terms of the hands-on component, but as well the theory component as well. So we start off with patient simulators, as you can see in this picture and in pictures subsequently. These are simulators that are equipped with a jaw, cheek, fake, but that simulate these parts of the mouth and the face, a fake torso as well, and obviously with fake teeth. And as we learn to manipulate our hands and to use the different instruments that there are many of in dentistry, materials and such, we also have lectures accompanying every part of the manual work that we learn as well. In dentistry, there's a very heavy laboratory component. So that is beyond the setting of the clinic. That's beyond the being with the patient chairside. And that happens behind the scenes. And we learn to do certain techniques there as well, such as setting up teeth for dentures or preparing crown, impression trays, things like that, that we learn as well in preclinical studies, once again, on fake teeth or fake props. So once again, at the end of every clinic session, we do have in almost all of the different classes, which are usually divided by all the different disciplines of dentistry. So that could be periodontics, orthodontics, endodontics, pedodontics, and such. We do have clinical case studies as well. So we do sort of like an FMD, split up into smaller groups. Sometimes it could be in the full class as well, but most of the time it's in smaller groups. And we look at real life cases demonstrated that have been demonstrated in clinic or in some of our clinicians' own practice, and we talk about what kinds of ways to go about each clinical case. So in the next slide, Marie-Claude here we have Some more pictures of different perspectives of our preclinical lab. What you'll see here is that essentially everyone has their own cubicle, their own mini mannequin and mini working station, which is equipped with all the handpieces you need. Once again, with that mannequin, with the fake mouth, as well your own chair, you have your own unit. So everything is kind of simulated that you have your own dental chair in your spot, and that is your spot for the entire 6 months. And as you see to the right, this is a picture of how up to date our clinic is, as well as our preclinical lab, which you see here. We have many monitors, we have as well speakers and microphones, and this helps us follow with the lecture at the same time as we do our manual work, and make the lecture as accessible as possible throughout our training. In the next slide, you will also see a greater close-up of what the mannequins look like. So these are state of the art, as well as the monitors, as you can see as well. So you have monitors on every side of every row, and it just helps us also give us a little overview of, okay, what is to be done today in today's clinical session. And yeah, so it's a great learning tool. Excellent. So now in the 3rd and 4th year is where clinical training starts. So this is where we transition from fake teeth, fake cheeks, fake mannequins to real life people. And what's great about 3rd and 4th year is that we have a very, very great balance between lectures, so all the didactic material, and actually treating real life patients. So everything we learn in class, not only from the simulation lab, but everything we learn in real time in 3rd and 4th year, we get to apply the next day, the same day, the day before, basically very close together with the time we treat patients. So that's fantastic. It's very hands-on. And buddy system, this is something that I really wanted to stress as well, because from my own personal experience, this is something that I gained from a lot. So McGill, I think, is very, very unique in many ways, but especially in this way, that we have a buddy system. It's kind of like a sibling or SIB system, where everyone, as soon as you enter the program, whether it be in Dent P or in 1st year, you are paired up with a student in every year above. So that kind of helps us create immediately a liaison and friendships right from the get-go. And these friendships are even more solidified in 3rd and 4th year, because 3rd and 4th year buddies or SIBs work together in ortho clinic. So this is a time where a 3rd year student will assist a 4th year student in ortho clinic, and they will slowly take over the patient load, and that kind of helps that buddy system really take place, and in a more practical way. And it's just a way to kind of learn from someone who's very close to us in the program, and someone who's very close to us in terms of the amount of knowledge. So it's a great way to pass down knowledge, and that I benefited from very much so. In terms of supervised by dentists and specialists, so this obviously, as we're students, we're in a learning environment, so we're always supervised by dentists and by specialists, depending on the type of treatment we're doing. So we always get that hands-on approach and knowledge transmitted as well. And what's exceptional about 3rd and 4th year clinical training is that we have clinical rotations. So these go beyond the undergraduate teaching clinic. Here we can go, for example, in almost every specialty, we have an off-site rotation. For instance, a pediatric dentistry rotation would be done at the Montreal Children's Hospital. In 3rd year, that would be typically a 1-day rotation. And in 4th year, that's about a 2-day rotation where you actually treat children and you can treatment plan as well. And then we have for oral maxillofacial surgery, this is a rotation that is very hands-on, a little bit different from dentistry, because it's more complex surgery cases where you go into an OR room, and this is done at the Montreal General Hospital, and that's typically 1 week long. And then we have oral facial pain rotation, which emphasizes the importance of the TMJ as a joint. And then lastly, we also have community dentistry outreach opportunities that are done beyond the curriculum, but also in a rotation form, namely at the Jim Lund Dental Clinic at Welcome Hall Mission. So we'll go to the next slide, please. Here's an image of our clinic. So just as pristine as our simulation lab, we have state-of-the-art facilities. This is really just a view here, as you can see, of 3 ops, but there's 39 ops, and every op is quite literally a little mini clinic. So everything you need to work is in your op, except for the supplies, which you need to go get. And as you see here in this close-up, you have your chair, you have your hand pieces, you have your assistant chair, and all charts are documented electronically, so every op has its own computer and sync, and it's for the patient, it's very real for them. They don't feel like they're in a teaching setting. They do feel like this is a one-on-one interaction, which is fantastic. And yeah, thank you.
Okay, so we're just going to go over a few common questions that we usually receive when someone is interested in applying. So in many pages of the website, you can find this little logo there, and that's what you will be clicking to submit your online application. Sometimes people have difficulties finding the program. It is actually under undergraduate professional and not postgrad med-den education. So that's for postdoctoral studies. So that's what you need to select here, undergraduate professional. And then you also need to click or select, because we're asking you your level of studies. A lot of people indicate at least 1 year of university, and that will not generate the dentistry program. You need to indicate bachelor's degree, which is what you will have been completing by the time you start dental school. And also, of course, to complete the application, you will need a credit card and a valid email address. Once you get your McGill ID, you will be logging into a system we call Minerva. That's the platform we use. And you will be receiving an email with your McGill ID number and a temporary PIN that you will be prompted to change once you access the first time. So you just enter the information here, you click login, and then you will be prompted to change your password and also to set security questions in case you forget your password, and then you can just reinitiate it. Once you receive, as I mentioned, the temporary password is usually in the format of year, month, day for your birthday. Okay, very technical information. So on your Minerva account, you will be able to log in and see the programs you have applied to. And also you will be able to check the list of documents that are required and start uploading your documents. For example, transcripts, we accept unofficial transcripts. So beside the name of the institutions you have reported on your application, you will have a link you can use to upload your documents. You also will have to use the template for the CV and list of verifiers and upload them directly on your account as well. Results like CASPERS or the DAT, when it's required, are sent directly to McGill upon your request with the companies, and then you can check there when they are received as well. I went ahead a little bit. So yes, you can upload a transcript on the Minerva. On our website, we do say that if required, we can ask at any time to receive an official transcript, but at this time it's not required. We can work with unofficial copies. It's not a problem at all. And once you have submitted all your documents and we have received all your scores, either CASPER or proof of proficiency, English proficiency, or the DAT when it's required, your application status will change to ready for review. It will remain that way up until the time we post decisions, which should be in January. If the message you have is items outstanding, that means that you need to look into this and make sure that you take the appropriate action to submit all the required documents. The academic workbook, for example, cannot be uploaded but sent by emails. Yeah, so it's very important that you stay on top of things, because as I mentioned earlier, and it's written here, past the application deadline or submission deadline, I should say, of November 3rd for the DMD program or March 3rd for the DENP program, incomplete applications will be canceled, and you don't want that if you want to be considered for admissions. For the CASPER results, the last acceptable date, for example, for the DMD program is October 22nd for the English test. The French test, I don't remember, I think it's October 25th, if I'm not mistaken. Usually we receive the test scores 2 to 3 weeks after the test date. If you have passed the test and have requested for them to be sent to McGill, you should not worry, we will receive them.